are thought to occur in as many as a third of patients hospitalized with COVID-19. In many cases, these clots can be deadly, such as pulmonary embolisms, which are blood clots that travel to the lungs. In fact, in nearly 1/3 of patients with COVID-19, these clots lead to death. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'll be talking about soluble urokinase plasminogen activator receptors' role in identification of blood clots for high-risk patients. An abnormal immune response is thought to be the major driver of severe COVID-19. One protein called soluble urokinase plasminogen activator receptor, or SuPAR for short, circulates in the blood and originates from immune cells and has been shown to play a major role in complications of COVID-19. Salim Hayek and a team of researchers from around the world have been studying SuPAR and its relationship to critical outcomes in COVID-19 cases. In a publication by the International Study of Inflammation in COVID-19, a multinational observational study of patients hospitalized for COVID-19, researchers found that higher SuPAR levels were associated with an increased risk of blood clot formation. Their new findings, published in the Journal of the American Heart Association, suggest that SuPAR levels in hospitalized COVID-19 patients were associated with venous thromboembolism, including pulmonary embolism, independently from a marker of blood clot formation called D-dimer. The authors therefore conceived that combining SuPAR, a marker of the immune system, and a D-dimer could improve the reliability of determining who is at high or low risk of blood clot formation among COVID hospitalized patients. In the study, researchers compiled data from 1,960 adults who were hospitalized for COVID-19 and who had their SuPAR levels measured at the time of admission to the hospital. All patients were monitored until they were either discharged or, in some cases, until death. Researchers measured D-dimer and SuPAR levels over a 30-day period during patients' hospitalizations and diagnosed VTE, that is deep vein thrombosis, and pulmonary embolism using ultrasounds of the lower extremities and scans of the lungs. Results showed that VTE occurred in 163 patients, and of those, 65 patients developed deep vein thrombosis, 88 patients developed a pulmonary embolus, and 10 patients developed both. Patients who developed blood clots had SuPAR levels nearly 50% higher than those who did not develop clots. And when SuPAR levels were combined with D-dimer, researchers could classify 41% of study participants to have low risk for occurrence of VTE. Now that the association is made between SuPAR levels and blood clot formation, clinicians could assess who is at high or low risk, which will help them decide what therapies to use to treat them. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.